So let's talk about how not to birth like this. Though some of you might be brainwashed into thinking that this is okay, this is normal, and this is completely appropriate for when birthing a baby. Like, she's just expressing herself, birthing hurts. It's painful. Let her scream. Let her yell. This is what the media tells us is normal. This is what we see in the movies. It's got to be right, right? Wrong. By no means are we bashing this beautiful woman giving birth. We know she's doing the best that she can at the moment. But the facts are screaming, being irate, yelling, fighting. This does nothing for your labor and delivery but make it tougher, especially in a hospital setting. These doctors, these nurses, they see you acting like this. The one thing that they want to do is shut you up as soon as possible, even if that means coercing you into an epidural or emergency C-section, saying that your baby's heart rate is dropping. Or, of course, my favorite, giving you a episiotomy without even telling you. I've seen it happen. If you do not know what episiotomy is, it's when they snip a little bit of your vagina sideways just to make your hole a little bit bigger and easier for your baby to come out. They see that you don't know how to push, they will do that. And sometimes they do not tell you. Which brings me to my next point. You have to stay in your present moment and as calm as possible when you are in labor. Well, how do you do that when you're feeling the feels, when the shit is intense? By preparing. And I know a lot of people in my comments, they say things like, you can't prepare for labor and delivery. That's not a thing. No, sweetheart. Not only is it a thing, but it's something that you have to do if you want the ideal birthing experience. I don't mean just read a book. I don't mean just educate yourself. I don't mean taking some classes. I mean actual practices that you're incorporating in your everyday life while pregnant, taking time aside to do your affirmations, taking time aside to do your meditations, your visualizations, your yoga, your breath work, changing your deep core beliefs about labor and delivery. I teach this in my book because it is so important, like changing your labor vocabulary. Words like pain, replace it with sensations. Training your subconscious mind for labor, because when I tell you labor is a mind game, I am not fucking lying. Your body knows exactly what to do, but your headspace will keep you going. Your headspace will tell you, no, this is not painful. This is sensational. This feels good. There's some women who have freaking orgasms while they're in labor because of what they did to their headspace beforehand. They actually trained their brain to think that labor feels good, and it is so possible. But you have to put the work in. It's not easy work. It takes discipline. But I feel like it's worth it, and it'll make your birthing experience something magical.